Let's talk botched. Hi guys, welcome back to my channel. Thank you so much for tuning in. I know that it's been forever since my last video, or it feels like it's been forever. I really do appreciate all the comments that are coming my way. Thank you so much for all the love that I'm getting. It means the world to me. If you guys have any content, specific content that you want me to make videos of, I need you to please send me that content. You need to tell me in my comments, private message me, let me know what it is you want me to make a video of, and I'll gladly do so. The intention of these videos is to get the right information on Hyaluron Pen out there, because I feel like there's a huge lack in information or in the correct information. So if there's something that you want to know, please pick my brain, ask me. Okay, enough chit chat, let's talk botched. So I have recently received a lot of communication, DMs, emails, WhatsApps from people who are super stressed out and are like, oh my gosh, am I going to be okay? Am I going to make it? Have I done permanent damage to my skin? And for that reason, I thought, let me just clarify what is normal and what is botched, because unfortunately the reality is you can have a botched hyaluron pen procedure, and that means that it requires intervention from somebody who can dissolve the hyaluronic acid. It's a problem that isn't going to resolve on its own, or it's a problem that's going to take a long time before it resolves on its own. So that can cause quite a lot of stress to clients, to you yourself if you've done your own procedure. Okay, so what is normal with Hyaluron Pen? Obviously there's going to be bruising, there's going to be swelling, and there's going to be lumps. Let's chat about bruising. Let's look at what bruising is normal before we look at botched. So please expect some bruising with your Hyaluron Pen treatment. Unfortunately, you have inflicted some trauma, especially if you've actually been able to see like a little papillary response. Bruising is blood underneath the skin, so if there's been any bleeding, it's a very high chance of there being some bruising. So please do expect some bruising during your hyaluron or after your Hyaluron Pen treatment. It's not to say that it's going to happen, but it's not, something hasn't gone wrong if you're bruised. It's normal. Okay. Then you've got to examine the lip before you do a Hyaluron Pen treatment. I'll always actually go and look into the mucosa and see, can I see any superficial arteries? Can I see any superficial blood vessels and capillaries? Can I see them? Because if I can see them, I can most definitely cause too much trauma there, which will cause a leakage, which will cause severe bruising and severe bleeding. So I want to try and eliminate that. So always examine the client's lips beforehand. Check, is her lips healthy? Are they dry? Are they cracked? Are they very, very thin? You get people who have had the habit of chewing on their lips, and they have incredibly thin lips. You get people who just have very vascular lips. So make sure that you've actually examined the lip before you do your treatment. Then also keep the shots really small on areas that are more vascular. The oral commissure area, this area is more vascular, which means when I do my shots here, I keep them really small. I'm talking about 0.01 ml or 0.015. I keep those shots really small. Okay, then you've got to stay out of the mucosa area. You've got to stay out of there, this wet area of the lip. You cannot do any treatment in there. If you do, you are going to have problems. I can guarantee it. So you've got to make sure you're staying far out of that area. You will have immense bruising, bleeding, lumps, you name it, you'll have it. So stay out of the mucosa area. It's not where we should be working. Then always, as usual, client consultation. You need to determine that your client is in fact a good candidate for the treatment, that she is suitable to have the treatment done. Go through her medical release form. You've got to know what medication she's taking, stimulants, what her daily lifestyle looks like. Those are huge factors to take into consideration before doing any treatment on any person, including your Hyaluron Pen. So make sure you've done a thorough consultation, and of course technique. I never have any issues with bruising or swelling. I mean, obviously you'll get once or twice in a year I'll get a case that is a little bit unusual, but for the better part of it I never have these issues because I've been able to work on my technique to the point where I can eliminate all these things. And like I said, it's not just necessarily what I'm doing, it's the tools I'm working with, how I'm using the tools, the knowledge that I have in terms of my client consultation, examining the lip, all of that combined will help really eliminate and minimize bruising. But some bruising is still to be expected. You get rare cases where you'll have severe bruising. If you ever go through that, please, then if you do a treatment on someone and you, I want to say, cause severe bruising, please do the effort to constantly keep in touch with them, monitor them, help bring their anxiety levels down so that they don't stress unnecessarily. If you feel like it is really severe, then make sure that you search for guidance and get someone's opinion on it. Bruising, unfortunately, can last anything from 4 to 14 days. Arnica oil is like my best piece of advice for anyone and everyone. I finish my treatment with it. I massage the area with arnica oil as I finish it, and I actually decant some and give it to my clients to take home. If they've got arnica tablets, I'm like, please go ahead and drink it. Some people have arnica tea, amazing, go and drink that. Any arnica is a huge help and it really helps break up that bruising very quickly. Okay, let's look at swelling. Please expect some swelling to occur, redness as well. If you've caused trauma to a site, you rupture blood vessels, there's leakage, the tissue expands. There's a lot more going on, so you've got to expect a little bit of swelling. When we sleep at night as well, you're lying down, all the fluid will go to that area, and when you wake up in the morning, everything will seem a little bit more swollen. Swelling normally lasts 3 days, and it's often the worst on day 3. So that is nothing to be alarmed about, or you're not having a reaction. Swelling is to be expected. Also, just a quick note, what's normal for me is not necessarily normal for you. Clients do often ask, is this normal? It's a very hard question to answer if I don't have any information on you, because how I respond to a mozzie bite will be different to how you respond. So what's normal for me and what's normal for you are two different things. Okay, let's talk about lumps. Please expect to have a little bit of a bumpy or lumpy effect or feel or look for a few days, 5 to 15 days or 4 to 15 days. It doesn't always happen. I must honestly say that I really genuinely don't have this issue, but I always create the expectation that a client should not worry about it if they do come across a lump or a bump. For the first few days, if they can see it or identify it, massage it every day. Drink lots of water. You need that product to disperse underneath the skin. So what could cause lumps? Obviously your technique, making sure that the product is your pocketing. It normally comes down to pocketing. Make sure that you've got enough pressure to get the correct penetration of your product. Then don't forget to massage. Massaging is extremely important. If I've done a lot of products on a client or I see that it's a lot for them, I'll massage the one lip before I even move on to the second. But at the end of your service, make sure that you're massaging correctly and thoroughly enough. It is extremely important. You have to, again, disperse the product evenly underneath the skin, and massaging assists with that in a great way. Again, I also tell my clients to continue with massaging for the first day, 2 days after the treatment. If they feel like everything's smooth, then there's no need to massage. But if they're feeling like there's a little bit of unevenness, then that arnica oil to massage with it, excellent. Also keep in mind thin lips. If the lips are very, very thin, you've got to adjust your technique and the amount of product you're using accordingly. So again, examining the lips. If you're using poor quality serums or even old hyaluronic acid serums, let's say you've opened a syringe a couple of weeks have passed, you've still not used it, client returns, the quality degrades, and poor quality product as well. They'll be more inclined to causing lumps and to gathering instead of dispersing evenly and naturally. Of course, poor quality pens. If your pen is inconsistent in the quality, you get what you pay for. So please keep in mind, if you've gotten some cheap pen off of some online store, don't expect wonders from it. So keep in mind that you've got to purchase good quality products, which normally means that you want to purchase them from reputable companies who can offer you support. Then of course, pay attention to your client's skin. Is there a lot of dry, dead, excess skin on the surface of the lips or wherever you're doing your shots? Because obviously if there is a buildup of dry skin, your product can get stuck in that and will also struggle to penetrate to where it needs to go. That means that you're also going to have a much bigger chance of having lumps or bumps left behind. And the last thing, which is really important, is check that the size of your shot is appropriate for the type of skin that you're working on. The biggest issues that I've seen, and this is where the botched comes in. What is now actually botched? Botched is lumps. Lumps that are still present 4 weeks after your last treatment. It is highly unlikely that they're still just evening out if it's been such a long time. If it's been such a long time and you still have a lump visible or you can feel one, then there's a good chance that it's one of the things that I've mentioned. It was shot into the wrong area of the lip. Maybe the shot was way too big for this type of skin you were working on. I see it on cheeks all the time. Your shots on cheeks got to be really small, guys. 0.01, 0.015. If you haven't covered an area before, don't go and use a thick serum. Try something thin. Just get the feel of it. Get some confidence and then move on to something that will give you more longevity and a quicker result. But that is often where I see the most botched work, it's lumps. Lumps on lips that require dissolving, lumps on cheeks that require dissolving, and that's so heartbreaking when that happens, because I've even had situations where the therapists have been trained to use or instructed to use a certain shot size and serum, and that's left bad lumps on lips and on cheeks. And it's really sad because they were literally doing what they were instructed to do by their trainer, which was obviously just poor quality training. But that's really sad because now, unfortunately, intervention is most likely needed. The dissolving is most likely needed. So keep in mind that you've got to use the appropriate shot size for the appropriate area. If the lumps are still there after about 4 weeks after the last treatment, there's minimal things that you can do about it, and it's very likely that that client will have to go to someone who can dissolve it. I have seen lumps in lips 10, 11 months after the last treatment was done, and yes, they're small, but they irritate the client, and therefore it's a problem. If you have lumps that are only visible when you're smiling, then you can take into consideration that maybe you're a little dehydrated, and those lumps, usually they will dissipate completely on their own over time as they naturally break up. But if it's a big lump, one that is visible on the skin when the skin is relaxed, then unfortunately it is unlikely for that to go away just completely on its own. I hope that information is helpful to you. I hope that it can either help put your mind at ease or give you the information that you need to find the appropriate help. Please feel free to like, comment, share. Any feedback is highly appreciated. I'm not at my studio today. I am actually at home, so if you've seen a cat or some animal walk past me, I apologize. But thank you so much for watching. I truly appreciate the love that I've been receiving. If there's anything specific you want me to cover, please tell me what that is so that I can make sure that I give you the right content. And yes, until my next video, thanks so much.